from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about the importance of simulation and education in a medical setting and its impact on healthcare delivery. Our guest today is Jessica DiPaolo, the Advanced Program Coordinator for Simulation in the Kolchowski Research and Education Institute at Sarasota Memorial. Jessica, thank you so much for joining us.
Thank you so much for having me.
What does it mean when we say simulation in a healthcare setting?
Well, simulation really, as it's defined, is recreating scenarios and situations in a safe and reproducible environment so that anybody who comes into them, physician, nurse, allied health professional, can train in a safe and reproducible environment and make mistakes, and practice makes perfect.
So we're not just talking about for physicians.
No, we're talking everyone from brand new graduates to very experienced providers to high school students and even our local fire department.
How did simulation and structured education become such a critical part of modern healthcare practice?
Absolutely. So simulation has been around for centuries. However, in the late 70s, when the aviation industry identified that they had some safety concerns, they invented what's called crew resource management. And healthcare kind of coupled on with that. Those processes, those structures to be able to do things reproducible and keep patients safe is where the two melded and where we are today.
What problems in healthcare delivery does simulation help solve better than just traditional training?
Absolutely. So those high-risk, low-volume situations, a cardiopulmonary arrest or a emergency delivery or a postpartum hemorrhage of a patient, we can recreate them over and over and over again and bring the same or different clinicians together as a team to be able to practice in a safe space to where they are experiencing that high-stress situation in a comfortable learning environment where they feel safe to make a mistake, have a debrief afterwards and learn from those mistakes and learn together so that we're better clinicians when we go back to the hospital setting.
Patients listening might say, make a mistake. I don't want to hear that my clinician made a mistake.
Sure.
Why are mistakes a good thing?
Well, mistakes are where we learn, right? So let's say, for example, we do X instead of Y, and we see it on a camera because a lot of times we'll record the scenarios that we do and the simulations that we do, and we can actually watch ourselves in the replay and go, wow, I probably could have done this faster. I could have done this a little bit differently. And we develop that muscle memory, and that muscle memory then helps us when we experience that again in the real situation. We go, oh, well, the last time I did that in the scenario and the patient responded like this, I want to do that again. And so our mannequins in our simulated environments can recreate, I give a medication and it responds to that medication, or I perform an interaction and the mannequin responds to the action, or even an inaction. And we watch that pathophysiology happen in real time. And we then know in our muscle memory and watching our replay, okay, I can do it this way the next time, or when I see a patient in the clinical setting, I'm going to do it this way, and follow this process.
So medical simulation is really very similar to like an athlete watching tape to make sure they win.
Absolutely. Absolutely. Great analogy.
How does simulation help these medical teams prepare for rare situations and complications? Because you wouldn't think that a simulation would be something rare. You'd think that it would be your run-of-the-mill.
Not necessarily, right? So we obviously train, let's say, for example, the American Heart Association, our ACLS and BLS, those basic life support and advanced life support. Yes, that is something we train on every 2 years, and we maintain competence for those types of situations. But you also have conditions and situations that are rare. For example, a cord prolapse. So the cord in a delivery is presenting first. That's an emergency where we don't see it very often, but an interprofessional team comes together of nurses, physicians, respiratory therapists, and all levels skills to come together in that practice environment, we recognize that there's a cord presenting before the baby. The nurse goes into action and performs what he or she knows to do to make sure that patient and that baby are what we call ballotable. And the physician comes in, and the obstetrician comes in, and the respiratory therapist comes in, and we actually run through that scenario. And then afterwards, we get together as a team. So not only are we learning how to care for the patient, but we're also learning how to get better as the teams, so that when we come together organically in the clinical environment, we've got it. We've practiced, and the staff at every level knows, okay, this is how we're going to work together for the success of the patient and the baby.
You've mentioned muscle memory a few times. What role does that play in healthcare delivery as a whole?
Absolutely. So as much as we would like to think as lay people that there aren't processes and standards and protocols that happen, they exist in everything that we do. And just like an athlete, or just like you would make a recipe and you've done that recipe 100 times to where you don't have to look at your recipe card anymore, that muscle memory is something that we developed, whether it's a procedure, for example, a chest tube insertion, a catheter insertion, or even communication. We develop those muscle memories to be able to interact with various healthcare providers, whether it's communication or a skill.
You mentioned new clinicians and experienced providers. I want to talk about that. How does simulation support both new clinicians compared to experienced providers?
Absolutely. Our new clinicians are so familiar with simulation and all of the different aspects of it that they can integrate very easily, but it's still stressful for them. When they come out of their academic environment, which is high stakes, right? They have to pass something in order to be successful. They come into the sim environment knowing that stressor, and now they are here practicing as providers. And then you have experienced physicians and clinicians that may not be familiar with simulation, but it helps them because they can translate that knowledge into practice and those skills that they learn or know and reaffirm in the simulated environment back into their clinical space.
And I imagine with all the new technology and everything, ongoing education is just as important as that initial healthcare training.
Absolutely. As providers, we all have, whether it's an accrediting body or a certifying agency or a skill that we want to maintain proficiency on, we are required to do continuing education. And sometimes it is a health stream or a journal article, but a lot of times we can incorporate simulation into that, and so that we all stay current in what our practice is.
How are advances in technology changing the way simulation is done?
Absolutely. So we used to have just basic CPR torsos, right? Very rudimentary, no technology. Then came the high fidelity simulator that can bleed and it can, blink and move independently on you. Well, now we're utilizing a lot of augmented virtual and mixed reality, so that not only can we have a mannequin, but we can also immerse you into a different environment, as well as going multi-campuses. We're growing as a healthcare system, which is phenomenal, but we can now have learners at multiple campus sites and have a provider or a instructor in one space, and we're all in the same virtual space, learning from all around the area.
Can you talk a bit about all the amazing new things in the Kolchowski Research and Education Institute that help put Sarasota Memorial at the forefront of simulation learning? Because I know that building was developed with simulation for healthcare providers in mind.
Absolutely. It truly is an interprofessional space. And so in addition to our orientations that we have there, all of our graduate medical education residents, internal and emergency medicine, do all types of skills throughout their entire residency stay with us. We are one of 3 Da Vinci training centers in the entire country that has Da Vinci robots that can train and credential our providers and our nursing staff and all those types of folks that are in our OR spaces. We've got our cardiothoracic training program that is utilizing high-end immersive trainers and our anatomage table to solidify anatomy and physiology concepts and provide echocardiogram training. Our immersive space can create let's say, for example, we want to train trauma, and we can take a 360 image of a trauma bay. We can raise the temperature in our immersive room and immerse our learners, our interprofessional learners, in that immersive space, so that I don't have to interfere with patient care and with patient flow, and I can reproduce that in a safe space. And we are a true destination environment for both our healthcare professionals as well as our community.
Can you talk about how you've seen this new space impacting the simulation and education already?
Absolutely. With the numerous activities that we're holding in throughout the entire space, the positive feedback not only from providers, but all types of staff. We're training our first physicians group, and the impact that we're seeing in the reduction of our time to first defibrillation with all of our mock codes that we're providing, our orientation that we're doing for all of our nursing staff, and just the overall positive response that we're getting and the draw. Every time we turn around, we've got a new group that's coming that wants to utilize the space for any type of learning. It has been just amazing and wonderful to be able to disseminate throughout our system.
You've mentioned a few of the different types of training, but can you talk about what kind of simulation or what kind of patients can be simulated there? Like, do you have a pregnant patient? Do you have an elderly patient? How is that?
Absolutely. So we have, her name is Lucina. She is our labor and delivery mannequin who can truly deliver any type of patient situation. And our mannequins range in age from a 32-week-old preemie all the way up to an elderly patient. We have mannequins that are what we call high fidelity to, like I mentioned before, have the potential for sweating and bleeding, all the way down to a mannequin that is there for IV insertion and airway intubation for trainers on a micro preemie. We run the socioeconomic gamut as well as the age gamut in the simulators that we have.
And I also saw you mentioned before, like learning echo. You even have a mannequin to test the precision with the Da Vinci or with the robot to make sure they're hitting the right point.
Absolutely. So we have a mannequin in our operating space that has actual organs inside that they can utilize to train, and mostly for, not necessarily for our providers, but our nursing staff, so that they can understand where precisely to put what we call the trocar for that particular case and for that particular patient, and actually see organs and see inside while they're on the endo tower in the patient room, in the operating room.
And you mentioned the 360 immersive space, but all of the simulation rooms are really 360 immersive. Yes. Because they've been created to look like real
absolutely
spaces, correct?
Absolutely. We have our labor and delivery room, which has all of the actual items that a labor and delivery room would have. And all of the devices that we use in our simulation space are the actual devices that our clinicians are utilizing in our clinical spaces. So they can utilize what they're using here is the same as in their clinical environment. We have an intensive care unit room that has booms that move exactly like our ICU rooms have. We have a medical surgical space that is mocked up to one of our medical rooms. And then we have a very large skill environment that looks like an emergency room bay with bays or a PACU type of environment.
Why should patients care if their providers are participating in simulation?
It gives you comfort as a patient to know that your physician, your nurse, your therapist, whatever, physical therapy, whatnot, is ongoing training and maintaining those high standards that it takes to be an incredible physician, an incredible clinician. And practice makes perfect, right? And being able to know that they are utilizing what we have to become and remain great at what they do should give the community comfort, knowing that we have what we can to make our clinicians and keep them functioning at the best capacity.
You've already mentioned all the amazing technology that exists now, but what excites you the most about the future of education and simulation in healthcare?
I think it really comes down to the augmented, virtual, mixed reality and AI. AI and these types of devices and these mixed realities are here to stay, and utilizing them to be able to close that gap from academic into the clinical environment and into practice, as well as utilizing them as an adjuvant to help us streamline processes in creating simulations and creating scenarios. Putting someone through a virtual reality procedure and being able to utilize AI within that to give them the debrief materials to show how they could perform differently, make small adjustments, and really using it as a supplement to what we already do. The world is our oyster, and we're really looking forward to what happens in the future with these platforms.
In previous podcasts, we've talked about the simulation and education happening at Sarasota Memorial, but this is such a deep dive into what simulation is here. So I really appreciate you answering all these questions. Is there anything else you want to add?
We as a healthcare system really value our education and training for all of our clinicians because we obviously want to be the greatest and best at what we are and what we do. And so to be able to be a part of this education and research institute that the Kolchowskis have graciously helped us create is an honor. And I'm so excited to continue growing and moving this program into the Northport training environment and really growing and helping our community and really giving back has been just incredible, and I'm grateful.
Jessica DiPaolo, thank you so much for being here.
Thank you so much for having me. This is a crazy, wonderful opportunity. I'm so excited to share.
If you liked this episode of HealthCasts, please like and comment, and visit smh.com/podcasts to listen to more experts like Jessica talking about the health issues which matter to you. Thank you so much and have a great day.